Hello, my name is Bailee Kimble, and I will be talking to you today about traumatic injury prevention, specifically ACLs, and validating a novel high-impact online intervention. So we'll start here at the introduction. Some quick facts. Some of you may know, but knee injuries are the most common season/career-ending sports injury, and about 80% of these injuries do require surgery. Research shows that the strongest modifiable risk factor for ACL injury, other than sport of choice, is whether an athlete engages in neuromuscular injury prevention training, otherwise known as IPT. This ACL injury prevention neuromuscular training has been shown to reduce ACL injuries by 50%, yet is not often or used as often as it could be. Many coaches know that knee injuries can be problematic, but they lack the knowledge and skills to prevent these types of injuries. Current research on ACL IPT education has relied on relatively long, resource-intensive in-person sessions, and no study has utilized a brief web-based delivery to improve ACL injury risk and mitigation comprehension. Web-based methods have the potential to reach audiences all over the world, increase accessibility, be cost-effective, and less time-consuming. Video interventions provide the ability for multisensory learning, reduce workload, and increase motivation to view and/or learn. Strong evidence suggests that videos increase informed decision-making, are effective for learning, and increase both short and long-term retention. Therefore, the aim of this study is to evaluate the effects of a brief web-based educational intervention on improving ACL injury prevention comprehension and implementation likelihood among coaches of adolescent female athletes participating in landing and cutting sports. You can see here that the coaches display significantly less ACL prevention knowledge, risk estimation skill, and general ACL knowledge compared to sports medicine professionals. So now we're down here to our methods section. Our objective was to create a new educational tool that increases ACL injury understanding, which ultimately decreases injury rates, thus improving quality of life. We tested this hypothesis by evaluating the effectiveness of a brief educational intervention using a 3-arm randomized control design. We randomized the participants into 3 groups. Each group took the pre-intervention survey about ACL prevention knowledge and skills. They then watched and read their respective materials and then took the survey again. The intervention group was then given a 3-minute animated video, including various information components aiming and improving capability, motivation, and opportunity. The placebo control group intervention received an educational video from the CDC about concussions that is comparable in duration to the ACL video. The active control group received text-focused information from a WebMD article on ACL injury prevention. Both the intervention group and the active control group received ACL-related information, including the purpose of ligament injury mechanisms and severity, risk factors, and proposed exercises for injury prevention. This information was displayed through animation and text, respectively. In addition, following the brief intervention, we asked participants regarding their likelihood of implementing the PT in their own coaching. So our analysis, we had the pre and post intervention comprehension and the pre and post feasibility of intervention results. They were analyzed by a 2-way repeated measure ANOVA. The model included intervention group, the ACL animation versus the ACL text versus the placebo control group, with time pre versus post intervention. The analysis will determine the means values per group, p-value, and 95 confidence interval. If there are significant group by time interactions, results will be presented as an affected size and 95 confidence interval for the group sizes. Each variable will be assessed independently. We will use the multiple comparison adjusted alpha of 0.01 for all 3 measures. Now to our results. So we have some tables right here. So as you can see, the red lines are the understanding of risk in the first graph, the general ACL knowledge in the second graph, prevention understanding in the first graph, or in the third graph, and then in the fourth graph, severity understanding. As you can see, the red lines are significantly higher in the post-ops for each of these graphs, proving that the ACL video was the more effective in this test. For the general ACL knowledge, a lot of the people came in with already a lot of knowledge, so there was not a lot of room to improve that there. The results of this project also show that coaches who watched the animated video improved their ACL risk and midation comprehension by 12%, while the control group showed no change at all. This data shows that the ability to successfully implement a web-based randomized control trial. This also suggests that coaches who watch the animated video are more likely to implement an ACL IPT with their athletes compared to the control group coaches. It shows that the coaches who watched the animated video thought implementing an ACL IPT would be feasible, while the controlled group did not find this to be feasible. This data highlights our ability to successfully implement a web-based randomized controlled trial. Our data suggests that coaches who watched this video were more likely to indicate implementing and that this would be a good thing for their team. As we continue to research, we will discover if our data supports this hypothesis that educational intervention will improve comprehension and motivation to implement IPT, not only for coaches, but athletes and the general public as well. For our conclusions, ACL injuries are a significant public health and economic burden due to the severity and risk for long-term consequences. Because of this, we need to continue our research, and our team is working very hard to make that happen. Further evidence is needed to prove our results, but so far, the ACL video has showed the most improvement in risk, prevention, and severity understanding after this experiment. And here is a list of all of our references. I can get this over here. Thank you guys for listening, and I hope you enjoyed my presentation.